So one of the biggest problems with taking blood pressure at the doctor's office is something called white coat syndrome. That's where somebody's more nervous or has a higher level of anxiety. Usually when you're going to the doctor, you're not at your best and you're a little anxious because you're at the doctor's office. So your blood pressure readings are oftentimes a little bit higher when you take it there. So if you're type A high anxiety person, you may want to take your blood pressure monitor at home to get a more accurate reading. But I've also got Laura here to help demonstrate how to properly take blood pressure and also to teach you about some of the mistakes that I see doctors make and nurses make when they're taking your blood pressure in the office. So step one, and the first one, is you want to make sure that you're being measured in the left arm. So that left arm is important to use for blood pressure. The cuff should be nice and snug. Now, number two, you want the arm to be about as high as the level of the heart or a little bit higher. If the arm's too low, you can get a little bit higher of a reading. So keep that arm up a little bit higher. Number three, the arm should be totally relaxed. So go ahead and just let me hold your arm up, let me totally relax it. Because a lot of times a nurse is holding your arm or the doctor's holding your arm. You want to totally let your arm relax. If your muscles are too tense, you can get a little bit of an elevation in your blood pressure just in that alone. So these three things, again, in summary: left arm, arm at the level of the heart, and arm totally relaxed. If you do those things, you're going to get a much more accurate reading on blood pressure. So first, I think it's important that you know that all the research shows that diet and lifestyle are a much more effective way to lower blood pressure than medication. Medication has a laundry list of side effects: low libido, fatigue, nutrient deficiencies. Can be caused by a number of the medications. So anything you can do to avoid that is best. So let's talk about some natural strategies. Number one, eat real food. Like the DASH studies, which are this huge group of studies that have been ongoing for years, show that if you eat whole foods, fresh fruits, vegetables, lean meats, and you avoid packaged foods that have a lot of food additives and other salt and MSG, that you're gonna have naturally lower blood pressure. Super easy to do, just eat real food. Number two, consider drinking less alcohol. Studies show that people that drink 2 or more drinks a day have higher blood pressure. There are a lot of side effects to alcohol, one of them being that it damages the liver, but again, can cause high blood pressure. So avoid the spirits. Number three, understand that there are a number of nutrient deficiencies that can cause your blood pressure to go up. For example, magnesium, vitamin B1, and CoQ10 deficiency can all cause high blood pressure. So very simple to ask your doctor to run tests to measure your nutritional status, because if you've got low levels of nutrients, some natural supplementation just may be the solution to your high blood pressure. Hey, make sure to like and subscribe and follow for more tips like these.